To increase registrations to Join Dementia Research, together with a colleague of mine by the name of Jane Dyer, who is a clinical practitioner and also a research nurse, we looked at various ways of which we could possibly do it. And one of the things that we did do was to approach the team from the Memory Assessment Service to see whether they could speak to their patients and also their carers to see if they could be interested in being involved. They were really keen, they really did embrace this, but one of the issues that arose was the time. It was a time for them to actually find to talk about Join Dementia Research and also encourage them to sign up to the registration. We then went away and actually listened to what the team from the Memory Assessment Service were saying to us, and we recognised that we needed some help, possibly from somebody else. So we thought about it for a little while and we thought, well, actually, we are supported by the Alzheimer Society. Why don't we actually have a conversation with them to see whether they could support us with our initiative?
We were approached by Jackie and Jane for some support with increasing registrations with their initiative, and we were really pleased and excited to get involved. So what do we actually do? In practice, what happens is that once a month we collect referrals from the Memory Assessment Service. And that means we then make direct contact by telephone with people affected by dementia, that's the patient themselves and their families. We talk to them about what the service means, what it looks like, how it works, and if they're still interested then, importantly, we can register them over the phone. And for a lot of people, that is far more accessible. When you talk to people about Join Dementia Research, they are interested, and people have told us how much they value that one-to-one discussion. And of course, when we register people, we attribute that registration to the referring service.
Once we've actually registered somebody over the phone, as a telephone advisor, we're instantly able to see what types of research studies people might initially match to. We're able to go into a little bit more depth about what those research studies might entail. And once people hear that they're matched, they suddenly are quite happy and quite eager to get involved. We feel and we know that people that get involved in dementia research feel empowered to make a difference for future generations. Also, post-registration, we are able to provide ongoing support and advice to enable individuals to be able to engage and participate in dementia research. Now, that might be something as simple as resetting their password or updating their profile to ensure that they are actually matched to the most suitable studies that researchers are looking for volunteers.
So the lessons we've learned, this is about personal contact, and it works. More people are registering. And of course, people have questions when they register for this service, what it's like to take part in dementia research, how the service works. And that takes time, and it's time the help desk has. So we're very happy to be involved. And of course, when registering people, being able to straight away talk about the studies they've initially matched with, we found it really gives people a boost. And finally, this is about teamwork. And for ourselves at Alzheimer Society, working with the Memory Assessment Service and the West Midlands Clinical Research Network, we've just found a system that is win-win.